anybody. He's the director of Vaccine Education Center and Infectious Disease Division in Peds. He's the professor of vaccinology at Penn Med. You all know that he was a member of the Advisory Committee on Immunization Practices at the CDC. Was is the key word there. And I think he's probably the most quoted human being on the planet right now. Every morning you wake up and there's Paul. This morning he was quoted in the New York Times, and I suspect many other places. So one of the things that I really appreciate about Paul is if you ask him to speak and share his expertise, he's on it. So thank you so much, Paul. And I will turn it over to you.
My pleasure. So I actually was on the ACIP from 1998 to 2003. It's the FDA Vaccine Advisory Committee. That's the one that I was on for 8 years, but then RFK Jr. didn't want me to stay on. I don't know why. Maybe we've grown apart over the last 20 years. I don't know what's happened. Could I have been more supportive of the guy? All right. In any case, let's go to this. What is this wrong here? Oops. Okay. Everybody can see that? We're good? Okay, so let me sort of go over the events of the past year and where I think we're heading. So on January 30th, 2025, Robert F. Kennedy Jr. appeared before the Senate Health, Education, Labor, and Pension Committee. The head of that committee was Senator Bill Cassidy, who's an adult gastroenterologist, and spoke with me about 4 times before that committee hearing, including the night before the committee hearing. He certainly had his concerns, and he had concerns that were reasonable, given that for the last 20 years, Robert F. Kennedy Jr. has been an anti-vaccine activist, science denialist, and conspiracy theorist since 2016. So for much of the last 10 years, he has been paid hundreds of thousands of dollars to represent anti-vaccine activists in this children's health defense. And so he has basically served as any personal injury lawyer would, representing their interests. Now, it's interesting, when he was at this committee hearing, both Senator Cassidy and others said, well, you have to admit that vaccines don't cause autism, right? I mean, you have to at least admit that. And he said, show me good science, and I'll say that. Show me gold standard science, and I'll say that. And then towards the end of the committee, he held up this paper. It was by Mawson and colleagues. It was called Vaccination and Neurodevelopmental Disorders, a study of 9-year-old children enrolled in Medicaid. So this was Medicaid children between sort of 8 and 9 years of age in Florida. It was never published in a medical journal, never published in a scientific journal. It was never peer reviewed. It was absolutely uninterpretable, given you couldn't tell who got vaccinated when. And it was paid for by an anti-vaccine group. And he held this up and he said, this is a gold standard study. And he said that because it supported his point of view. He has these fixed, immutable beliefs that vaccines cause harm, and he will not be talked out of it. And whenever you hear him say gold standard or landmark, beware. So in any case, Senator Cassidy, I sort of knew he was going to be a yes vote because the night before when we talked, he certainly agreed that RFK Jr. was a nightmare. He said, quote, it's tricky, end quote. And that taught me that he probably was going to be a yes vote because in the end, it's a political decision. So in any case, when he voted yes, he held up a sheet and he said, I've had RFK Jr. and I have agreed to the following. Mr. Kennedy and the administration committed that he and I would have an unprecedentedly close collaborative working relationship. He has committed that he would work within current vaccine approval and safety monitoring systems and not establish parallel systems. And if confirmed, he'll maintain the CDC's Advisory Committee for Immunization Practices recommendations without changes. So on February 13th, 2025, Robert F. Kennedy Jr. was sworn in as Secretary of Health and Human Services by the Senate by a vote of 52 to 48. The next day, this headline appeared in a Lubbock newspaper about a measles outbreak. And the first evidence for this outbreak is that 2 children were admitted to a Lubbock, Texas hospital. So this already told you this was the tip of a much bigger iceberg. This was the first evidence that physicians had that there was measles in West Texas, in a vaccine in hospitalized, actually two hospitalized children. So you knew that this was already a much bigger outbreak than they'd sensed. It's centered on a Mennonite community um, in West Texas, which generally is insular, sequestered, doesn't seek out medical help from outside of that community, and are very much under-vaccinated. So those first couple cases became 58 cases, which became 90 cases, which became 198 cases. And then by February 26, 2025, a child died of measles in the United States. That's the first child death in this country since 2003. Then another child died. In total, there were 3 deaths. There have been 3 deaths from measles in this country this year. That equals the total number of measles deaths over the last 25 years. And the numbers keep growing. If you look at the current CDC, at least when there still was a CDC, it states that there are 1,431 confirmed cases in 42 states or jurisdictions, and there's been twice the number of outbreaks, meaning 3 or more cases in one area, as compared to last year. But if you talk to people on the ground, they say that is a vast underestimate, that the number of actual cases of measles is probably at least 5,000 cases and likely more. And this actually is what is the scariest thing to me, which is not only that I think we are heading into far more cases of measles and flu and pertussis deaths, it's that we may not know about it, because I think the CDC has been shredded in terms of its surveillance capacity and in terms of its capacity to fund immunization clinics in high-risk areas. And so we have a measles epidemic now that has reached a 33-year high. So measles, there's good news, this is an older crowd. So actually, I don't need to explain measles to this crowd, because probably most of the people on this call had measles, as I did. But just to refresh your memory, measles starts as a rash at the hairline, spreads down to the face, trunk, arms, and legs, a sort of blotchy erythematous rash. Before the first measles vaccine became available in 1963, about 3 to 4 million people would be infected every year, 48,000 would be hospitalized, and 500 would die. Hospitalizations were typically caused by severe pneumonia or dehydration, or both. About 20% of children with measles were hospitalized. And measles virus also infected the brain, causing about 1,000 cases of encephalitis per year in the United States, about a quarter of whom would be left with permanent brain damage, primarily blindness and deafness. And between 1 to 3 per 1,000 children would die from measles. And then there's this. Measles can cause a chronic infection of the brain. Typically, children get measles, recover, but the virus continues to reproduce in the brain, causing something called subacute sclerosing panencephalitis. And the child, usually 5 years later, 7 years later, sometimes 10 years later, has deteriorating handwriting skills, deterioration in personality, and gradually a descent into dementia and a vegetative state, from which there is no escape. This is an invariably fatal disease. It occurs in maybe 1 per 100,000 children. I've seen 5 cases, and they are heartbreaking. So now RFK Jr. isn't the head of Children's Health Defense anymore. He's not being paid anymore by anti-vaccine activists to represent their point of view. He's being paid by us to represent the best health for this country. So how would he respond? On February 27th, he appeared before a meeting in the White House, and in front of President Trump said, measles outbreaks are not unusual. They happen every year, even though we'd eliminated measles from this country by the year 2000. The virus has come back because a critical percentage of parents have chosen not to vaccinate their children. In fact, he said, we are doing better than Eastern Europe. We are the envy of the world. So because we were doing better than like Kazakhstan or Romania, he said we're the envy of the world. He should have more recently compared us to other similar countries in terms of healthcare. But in any case, he was basically trying to sell the fact, nothing to see here. On March 2nd, 2025, he wrote an op-ed to Fox News, which started off well. Referring to the measles outbreak in West Texas as a call to arms, RFK Jr. said that, quote, measles was highly contagious, especially to those who were unvaccinated. True. He said that vaccines not only protect individual children from measles, but also contribute to community immunity, protecting those who are unable to be vaccinated due to medical reasons. Later in the op-ed, he pretty much undid what he had just done regarding his call for community immunity, stating that vaccines are available for those who want them and that the decision to vaccinate was a personal choice. So you could, in Texas, reasonably choose to catch and transmit a potentially fatal infection in the midst of a fairly massive epidemic. He also said that good nutrition remains the best defense against infectious diseases. That's not true, actually. Vaccines are the best defense against infectious diseases. But he is, if you read his book, The Real Anthony Fauci, and I don't recommend this, but if you look at pages 185 to 188, you will find where this comes from. First of all, he doesn't believe in the germ theory. Doesn't believe that specific germs cause specific diseases, which you would think would be a minimal criteria for being Secretary of Health and Human Services. Could you do me a favor? Could you all mute, put yourselves on mute, just because I hear you, although I appreciate the laughter. In any case, he believes in the terrain theory, which is that the terrain is everything, the microbe is nothing, meaning that as long as you're well nourished, then you don't have to worry about suffering or being hospitalized or dying from these infections. And so that's why when these two deaths happened, he said these kids were in a food desert, which they weren't. He said these kids were malnourished, which they weren't. And he said that if you want to avoid or treat measles, what you need to do is just take vitamin A. And so people saw that as a binary choice. Why get a vaccine? Why inject myself with a biological agent when I can just take a vitamin, right? Vitamins are always good. And so people took vitamin A, and they took more vitamin A, then they took more vitamin A to the point of vitamin A toxicity, and a handful, I guess close to a dozen children were admitted to the hospital with liver damage secondary to vitamin A toxicity. March 17th, 2025, here he is with Sean Hannity at the Steak and Shake to promote beef tallow over seed oils as a road to better health. By the way, he talks endlessly about avoiding ultra-processed foods, but whenever you see him eating, he's always eating ultra-processed foods. Why is that? In any case, so this is him on national television with Sean Hannity. In the midst of a measles epidemic that had killed already 2 children in this country, he said the following on national television. The measles vaccine kills people every year, he said, which isn't true. He said the measles vaccine causes blindness and deafness, which isn't true. He said that the measles vaccine causes the same symptoms as measles virus, which isn't true. And he said that natural measles prevents cancer, heart disease, and autoimmune diseases, which isn't true. I think in a better world, this would have ended his stewardship as Secretary of Health and Human Services. He's in the midst of a massive measles epidemic that's killed 3 people, including 2 children, and he says this on national TV. In a better world, in a world dominated by logic and reason, a world in which we currently do not live, this should have been the end of him as Secretary of HHS, but it wasn't. So on April 29th, 2025, he visited Texas and wanted to make the point that chronic diseases like autism and diabetes deserve far more of our attention than measles. I don't know if you remember, when he was running for president, he said that he believes that vaccination has merely replaced infectious diseases with chronic diseases. And his words, that God has put him on this earth to eliminate chronic diseases. And because he believes vaccines and electromagnetic radiation and pesticides and food additives cause chronic diseases, he is on a war against those agents, including vaccines. He is on a war against vaccines. May 27, 2025. He stands up here on a 1-minute video on X with Marty Makary on his right, the Commissioner of the Food and Drug Administration, and Jay Bhattacharya to his left, the head of the National Institutes of Health, and says, quote, today, the COVID vaccine for healthy children and healthy pregnant women has been removed from the cdc.gov website and recommended immunization schedule. Bottom line, it's common sense and it's good science. We are now one step closer to realizing the President of the United States' promise to make America healthy again. It's interesting that 4 days earlier, Marty Makary published a paper in the New England Journal of Medicine listing 23 high-risk medical conditions for severe COVID, one of which was pregnancy. So 4 days earlier, he had published a paper in the New England Journal of Medicine saying pregnancy was a high-risk medical condition, and 4 days later, he said it wasn't. Because if you're going to work in this administration, if you're going to work with Robert F. Kennedy Jr., you have to bend a knee. And I don't know if any of you were watching today's committee hearing with Susan Monterez explaining why she was fired, but that was it. She was unwilling to bend the knee, and therefore she was out. So this already violated one of the commitments that Robert F. Kennedy Jr. had supposedly made to Senator Cassidy, that if confirmed, he'll maintain the CDC's ACIP policies recommendations without changes. The ACIP had recommended this vaccine for pregnant women. They had recommended this vaccine for young children, including healthy young children. Now, typically changes in vaccine policy are made by the ACIP with input from liaison groups, such as the AAP. Decisions are often open, transparent, deliberative process with allowance for public comment. His decision, this one that he made on X over a 1-minute video, was made behind closed doors in direct contrast to RFK Jr.'s claim that this would be an era of radical transparency. So should healthy children receive a primary COVID-19 vaccine? Actually, if you watch today's hearing, you would assume from what Rand Paul said that they shouldn't. And this is where we're heading. But in any case, there was a presentation by Fiona Havers to the ACIP in April of 2025. And she was looking at the question of to what extent has COVID impacted us over the last year, and especially looking at young children. And what she found was that there were over the past year, around between 270,000 and 430,000 hospitalizations from COVID, with 30 to 50,000 deaths from COVID. Regarding children, she found that there were basically about 10,000 hospitalizations for children with COVID. Most were occurring, if you look at the right-hand portion of the slide, in children less than 4 years of age. Of those who were hospitalized, about 1 in 5 were admitted to the intensive care unit. And about 152 children died of COVID during the past year. Again, it was primarily young children, children less than 4 years of age, especially children actually less than 6 months of age. And about half, depending on whether you were looking at 6 to 23 months of age or 2 to 4 years of age, were healthy. So the recommendation against to give the vaccine to healthy young children was at variance with the data that was presented by his own agency in April. And it was taken off the immunization schedule, as now, instead of being recommended, it was shared clinical decision-making. Now, SARS-CoV-2 will likely continue to circulate for years, if not decades, if not centuries. There are 4 strains of human coronavirus that circulate and account for maybe 10 or 15% of the hospitalizations we see at Children's Hospital of Philadelphia in the winter. One of those strains entered the human population in the late 1700s. Another of those strains entered the human population in the late 1800s. Let's assume this virus is going to be with us for a while. And know that all children will be fully susceptible by 6 months of age after passively transferred antibodies from the placenta have faded. Absent a clear recommendation for young children, parents might be less likely to vaccinate them, putting them at risk to be among the thousands of young children who will be hospitalized every year. Also, it becomes an issue of insurance coverage and liability protection, especially for the pharmacist. So Fiona Havers, to her credit, left the CDC when she saw that Robert F. Kennedy Jr. basically ignored the data she had just presented and basically changed an ACIP recommendation that was designed to help children in this country. She left the CDC, and to her credit, she didn't go quietly. She appeared on CNN, she gave quotes to the New York Times, and she warned that Americans are going to die. On August 19th, 2025, the AAP, American Academy of Pediatrics, to its credit, directly responded to what RFK Jr. had just done by putting its recommendations into the journal Pediatrics, making the point that infants and children 6 to 23 months of age are at high risk for severe COVID, and that basically I didn't show everything here, that certainly those who are previously unvaccinated need to be vaccinated. This was in direct contrast to what RFK Jr. had just said. And so RFK Jr. was angry. He was angry that they had dared to oppose him. And so what he did is what he always does when he's contradicted. It's what he did when he was at his Senate confirmation hearing. If ever you say to him, that you're wrong, he will say to you, you're in the pocket of the pharmaceutical industry. Everybody's in the pocket of the pharmaceutical industry, which is what he said about the American Academy of Pediatrics. He wrote on his X site, this is a screenshot from the AAP's webpage thanking the organization's top corporate donors. These four companies make virtually every vaccine on the CDC recommended childhood schedule. AAP is angry that CDC has eliminated corporate influence in decisions over vaccine recommendations, et cetera. So these four companies contributed to the AAP's Friends of Children's program, which support things like adolescent mental health, suicide prevention, and is a drop in the ocean of what the AAP receives annually from mostly the people who are members of the AAP and pay dues. But what didn't he do? What he didn't do is he didn't show data that supported his recommendation not to give a vaccine because there weren't any data to support that recommendation. So he did what he always does. He just says, you're in the pocket of industry. He questions people's motives because he doesn't have data. So should healthy pregnant women receive a COVID-19 vaccine? This was a study published in the American Journal of Emergency Medicine, which was a retrospective review of 8 published studies of about 860,000 women with COVID-19. Pregnancy was associated with a statistically significant increase in ICU admission and need for mechanical ventilation when compared with women of reproductive age infected with COVID who were not pregnant. And then this paper in JAMA Pediatrics was a retrospective review of 706 women infected with COVID during pregnancy compared with 1,400 women without COVID. Pregnant women with COVID-19 had a higher risk of preeclampsia, eclampsia, intensive care unit admission, maternal mortality, preterm birth, and neonatal mortality. Asymptomatic women with COVID-19 remained at higher risk for maternal morbidity and preeclampsia. The authors concluded, quote, COVID-19 in pregnancy was associated with consistent and substantial increases in severe maternal morbidity and mortality and neonatal complications. And also, we don't vaccinate pregnant women only for the pregnant woman. We also vaccinate it for her unborn child, because if you look at this graph, you can see that a significant number of children, that sort of black line, less than 6 months of age, were admitted to the hospital with COVID. The only way to protect them is to vaccinate the mother, to have the mother then passively transfer antibodies through the placenta to the child, which will then last for about 6 months, typically. Unvaccinated pregnant women then pose a risk to that unborn child, which is why the World Health Organization recommends COVID vaccines for pregnant women. It shows here that it's true for women who've never been vaccinated as compared to women, and as well as for women who've been vaccinated, and they recommend it for every pregnancy. 1 dose for every pregnancy. But here we are the only country in the world that doesn't consider pregnancy to be a high-risk complication, because Robert F. Kennedy Jr. simply declared it to be so. So if you look at this table, you can see where it says COVID-19 and pregnancy. There's a little gray box there on the left-hand portion of this slide. And then if you look at the upper right-hand portion, it says no guidance, not applicable. So we don't recommend this vaccine for pregnant women. So the American College of Obstetrics and Gynecology immediately responded and said they were concerned about and extremely disappointed by the announcement that Health and Human Services will no longer recommend COVID vaccine during pregnancy. As OBGYNs who treat patients every day, we've seen firsthand how dangerous COVID-19 infection can be during pregnancy and for newborns who depend on maternal antibodies from the vaccine for prevention. We also understand that despite the change in recommendations from HHS, the science has not changed. It's very clear that COVID-19 infection during pregnancy can be catastrophic and lead to major disability and can cause devastating consequences for families. And so there's a lawsuit basically against Robert F. Kennedy Jr. for making it very difficult for pregnant women to get a vaccine in this country. I've gotten many emails from women who were pregnant, went to their pharmacist and couldn't get the vaccine. And the only way they can possibly get it is to get a prescription from their doctor to get the vaccine. And then but unfortunately the pharmacist, because usually the pharmacist can give vaccines assuming it's an ACIP recommendation. But since this isn't an ACIP recommendation, there are many pharmacists and pharmacies that feel they can't give this vaccine. So there is a lawsuit against Kennedy Jr. for this, as well as for his statements about not vaccinating healthy young children. It's a group in Chicago. The person who's the face of this is a guy named Richard Hughes IV. The person who's doing the litigating is named Jimmy O. It's going to happen in Massachusetts. where they have standing regarding pregnant women who haven't been able to get the vaccine. And at least Jimmy O is very optimistic that he can win this lawsuit. We'll see. So June 9th, 2025, Robert F. Kennedy fired all 17 members of the Advisory Committee for Immunization Practices, claiming that they were in the pocket of the pharmaceutical industry. But what they really were is they were experts. They had an expertise and experience in the field. That is the last group he wants to have surrounding him. That's the last group he wants to have making decisions. What he wants people who are like-minded, who, like him, are science averse, anti-vaccine activists, and conspiracy theorists. That's his crowd. And thus violating the second commitment that he had made to Senator Cassidy when he said he's committed that he would work within current vaccine approval and safety monitoring systems and not establish a parallel system. When 2 days later, what he did was he just basically hired his own guys to be on the ACIP. Two members of the 7 he initially hired have testified at RFK Jr.'s behalf as paid experts in trials against Merck's HPV and mumps vaccine, a clear conflict of interest. One member, these were not successful lawsuits, but that's what RFK Jr. does. He, over the last 2 years, has made $2.5 million suing pharmaceutical companies. One member had published a bogus claim about harms caused by the mRNA COVID vaccines, claiming that it was killing healthy young male athletes, which was wrong, and it was shown to be wrong in a number of other studies. One member worked for the National Vaccine Information Center, which is an anti-vaccine group, and has lobbied for years against school vaccine entry requirements. And only 2 members were involved in primary care, likely to have either seen vaccine preventable diseases or counseled patients and parents about vaccines. So he basically replaced a group that had expertise with one that doesn't. And as a consequence, no medical or scientific group is now looking to the ACIP or the CDC for advice. On the contrary, they're just trying to figure out how to minimize the damage from the advice that's about to come out. So on June 25th, Kennedy, this to me was the unkindest cut of all, actually. He withdrew U.S. funding to the Global Alliance Vaccine Initiative, or Gavi. And there had been about a little over $2.5 billion commitment by our government to support the Global Alliance Vaccine Initiative, which was founded in 2000 and has immunized about 1 billion children and saved an estimated 20 million lives. So why did he do that? Why did he withdraw our funding? He held up this paper and he said, the problem is that the international community does not value vaccine safety. And as an evidence for that, he showed this paper called Evidence of Increase in Mortality After the Introduction of DTP Vaccine for Children aged 6 to 35 months in Guinea-Bissau, which is West Africa, a time for reflection. And so this article claimed that this vaccine was killing healthy little girls. Now, in truth, the same authors tried to repeat the study and couldn't, and later said we did not find that early DTP vaccine was associated with increased female mortality as found in our previous study. And then the World Health Organization commissioned studies in Bangladesh, Burkina Faso, Indonesia, and Papua New Guinea, which also showed no negative effect of DTP vaccination. So when he held up that study where he claimed that, there was that the international community didn't value vaccine safety, he called it a landmark study. He called it a gold standard study when it was quite the opposite. All it did was promote or forward his anti-vaccine point of view. June 26th was the first meeting of this new look science-averse ACIP. And what he did was there was a vote on thimerosal-containing influenza vaccines. So thimerosal is an ethylmercury-containing preservative that's been in vaccines since the 1930s. So before that vote, he had an anti-vaccine activist named Lynn Redwood, who was a member of his Children's Health Defense, and around 2000 founded a group called Safe Minds around the time of the thimerosal controversy around 1999-2000. So she presented data that were clearly wrong, that never referenced all the studies that have shown that thimerosal at the level contained in vaccines is in no way harmful. And normally when you give a talk before a vote, there's something called ETR at the CDC, which is evidence to recommendation. Your talk has to be reviewed by subject matters experts before you give it. Hers never was. And this is just showing that she is a member of Children's Health Defense. You see her which is the anti-vaccine group headed by RFK Jr. This just shows 6 of 9 studies that showed that thimerosal was never harmful. Nonetheless, she was able to get uh, the 5 of 6 voting members at the time to block thimerosal containing flu vaccine, which only means that it's not. This certainly won't be a big hit. This thimerosal containing flu vaccines represent maybe 4% of the market. The advantage of these vaccines is they're multi-dose vials because you need a preservative in multi-dose vials. So if you're having like a mass vaccination campaign in your company or whatever, it's nice to have multi-dose vials and to have a lot of single-dose vials. So this just eliminated that. It was an anti-science vote, is what it was, and it will no doubt be the first of many. Just stay tuned Thursday and Friday of this week, and you'll see more. On August 5th, RFK Jr. canceled $500 million in funding for mRNA vaccines for diseases like COVID, which technically he couldn't do. Really, he couldn't do the Gavi thing either. He couldn't say we're not giving money to Gavi either. That has to come from the State Department. That's true here too. This is a State Department decision, not his. Nonetheless, in this land where the law of the land doesn't seem to apply to anybody anymore, this is what he said. And he said the reason for that he was withdrawing money from this government research development authority, is that the data show that the mRNA vaccines fail to protect against upper respiratory infections like COVID, even though the goal of this vaccine is to prevent hospitalizations and death, which it clearly did. It's probably saved between 2 and 3 million lives in the US. That we're shifting funding toward a safe, broader vaccine platforms that remain effective, even as viruses mutate. First of all viruses mutate. They mutate differently. For example, influenza vaccine or virus mutates from one year to the next so much that vaccination or previous infection the year before doesn't protect you, hence the yearly vaccine. HIV mutates during a single infection. It's constantly mutating away from your immune system, which is why it's so hard to make an HIV vaccine. Measles virus also mutates, but it's never mutated away from vaccine-induced immunity, even though the vaccine's been with us for more than 60 years. So he said that HHS has determined that mRNA technology poses more risks than benefits for these respiratory viruses. He just makes this up. He said HHS will invest in whole virus vaccines. Actually, I should go back and say it's a remarkably safe vaccine, the mRNA vaccines. I mean, it's a cause of myocarditis, which is generally sort of the 6 to 29-year-old male, usually within 4 days of initially their dose 2. We haven't really seen myocarditis with this vaccine in the last 3 years. So in the world of usually having to pay a human cost for knowledge, I think the human price paid for knowledge with this vaccine was pretty darn minimal, and it clearly works and saved lives. He said HHS will invest in whole virus vaccines and novel platforms that don't collapse when viruses mutate. So he said, it's like he's just discovered this, right? Whole inactivated virus vaccine. Interesting concept. First advanced by Louis Pasteur in the late 1800s with the rabies vaccine, Jonas Salk with the inactivated polio vaccine. And then he said mRNA COVID vaccines become ineffective due to antigenic shift, thus confusing this virus with flu, which has a segmented genome and therefore can have a dramatic antigenic shift. That's really not this virus. So what's next? This is on C-SPAN. He declared that by September, the United States will uncover the cause of the autism epidemic and eliminate it. Quite a promise. People were really worried. I'm still worried that there's going to be something related to vaccine, hepatitis B birth dose, or aluminum adjuvant containing vaccines. But at least the initial statements were that it's acetaminophen or Tylenol given in pregnancy or folic acid deficiency. Although it was just a paper in Sweden that came out that was excellent that showed that acetaminophen in no way increases your risk of autism. But I would say that he's going to hold up some study in the next month or so, which he will claim is a gold standard landmark study that will be exactly the opposite. I think he's going to go after aluminum adjuvants in vaccines. There are 7 vaccines that contain aluminum adjuvants given to young children, all for, I think, for the purpose of really, many ways, manipulating the vaccine recompensation program. And he's also going to, as we know, on Thursday afternoon, he is going to, his new look ACIP is going to go after the birth dose of hepatitis B. Because his goal is to make vaccines less available, less affordable, and more feared. He will manipulate the vaccine injury compensation program. He's already said he's going to do that. He's already hired a law firm in Arizona to do that. Do that, and we'll be right back to where we were in the 1980s. So I'm glad I'm speaking to somewhat of an older crowd. You may remember that the flood of litigation in the 1980s drove vaccine makers off the market. We went from 18 companies that made vaccines in 1980 to four by the end of that decade. And the only reason we still have any companies that make vaccines is because of the National Childhood Vaccine Injury Act, which contained this vaccine injury compensation program, which at least stopped the bleeding that was associated with this flood of litigation at the time. And I think RFK Jr. just wants to reopen that wound. So I'm going to try and end on somewhat of a positive note, and then I'll take your questions. Science is a powerful thing to have on your side. And I think that's important to know. We do have that. And so Galileo, when he was had written his second treatise supporting Nicholas Copernicus's notion that the Earth revolved around the sun, um, he he was put in chains by the Roman Catholic tribunal because he had dared to say that the earth wasn't the center of the firmament. And he was sort of forced to recant what he said. But later he said regarding the earth, and yet it still moves. I mean, you could put me in chains, but that doesn't change the fact that the earth revolves around the sun. I think that's true here too. I think no matter how many times RFK Jr. is going to claim that one vaccine or another causes autism, or how many sycophants or discredited doctors or discredited physicians or media venues or congressmen he gets to echo his theme. They don't. Vaccines don't cause autism. And that is a powerful thing to have on your side over time because science does win out in the end because it has to. Okay, that's our URL here at the Children's Hospital of Philadelphia, vaccine.chop.edu. And I will now stop my share and take, there you all are. There's all your faces. Thank you for your willingness to show your faces. So I will take any questions that you have. So maybe, Lucy, do you want to? Maybe we can have people just kind of raise their hand, and then I'll call on them, and they'll start talking. Or would you prefer this chat thing?
I think raising hand is fine. There is one in the chat, though. So what can we do? Should we be protesting in the street every week until this lunatic is removed from HHS secretary?
Okay, so it's a political problem, and therefore it has a political solution. At some, I mean, so what are the possibilities? The possibility are that at some point people in Congress will grow a spine and vote for the health of children in this country. I'm not going to wait for that. The second possibility is that the companies would band together and say the few remaining companies that make vaccines for American children band together and march into Donald Trump's office and say, make it onerous enough. Make it onerous enough for us to make vaccines, and we won't. They're not going to do that. They're not going to do that, one, because they're living under what are crushing tariffs right now, and they are having to justify what are considered high prices for their products. This is the last thing they're going to defend. I mean, vaccines are a small part of what they do. These are products that are given once or a few times in a lifetime. They're never going to compete with drugs that are given every day. And so that's not going to happen. So the only other possibility is that Robert F. Kennedy Jr. will become such an embarrassment to the Trump administration that Trump will ask him to step down. But I think we got a long way to go on that. I think Kennedy helped him get elected. I think he likes having the name Kennedy as part of his Republican cadre. And there are ideas. I mean, I know what Bernie Sanders, who I talked to last Friday, wants to do is he wants to get all those organizations, the American Academy of Pediatrics, American Public Health Association, ACOG, all the really 20, almost 24 organizations that basically have asked for him to step down, and now have hundreds and hundreds of thousands of physicians who have asked for him to step down to have a media day in New York or media day in DC, where we just all stand up and say he's got to step down, just to draw attention further to the matter. But I don't know. I mean, I think it's tough times ahead. I mean, we've had 270 deaths from influenza in children this year. We haven't seen that number since the 2009 swine flu pandemic. We've had 10 children die of pertussis this year. Last year we had 2 deaths from pertussis. So it's getting worse, and I don't know how much worse it's going to have to get before somebody stands up.
Is there an ongoing effort for academic medical centers to get together and publish CDC-like guidelines?
Right. So what to do? Well, the CDC, I think, both the ACIP and by extension the CDC, I think, have not become trustworthy sources anymore. I worry about it. Wait till see what happens in the next 2 days when they try and eliminate the birth dose for hepatitis B, which I'm happy to talk about if you want, but why we have a birth dose. But I think what happens, like the AP now has its own committee of infectious disease, which is an ACIP like equivalent for pediatric vaccines. They've been working with insurance companies to make sure that those vaccines are covered. And AHIP, the American Health Insurance Plans, has also stepped up and said, we will insure vaccines for reasonable uses. And there are consortiums now in the Northeast, like in Massachusetts and other in the Northwest, where they've formed expert committees to sort of advise and then worked with insurance companies to make sure vaccines are given. But I think for practitioners and parents, it's going to be a confusing time because there's going to be a lot of sort of different fragments of groups giving information, and there may be contradictory advice, which would be even more confusing.
Is there a financial incentive for insurers to promote vaccinations?
Yes, for sure. Much easier to pay for a vaccine than a hospitalization. So I think that's why AHIP just came out with a statement saying we're going to support the best medical evidence to give vaccines. So that was reassuring.
How do we best communicate the science to the public regarding the safety of vaccines?
So it's hard because data is so siloed and fragmented. It's hard to get across that bridge. It really is. I mean, I was on MSNBC this morning. I'll be on CNN this afternoon. So they're fine having me on. I mean, I'm preaching to the choir. But I've asked to be on Fox News. Happy, and I've tried to work with Mark Siegel, who's pretty reasonable and is their medical correspondent, to say I'm happy to be on Fox News. And he has said to me more than once, okay, but you cannot say anything negative about RFK Jr., which is a tall order, I think, these days, because it's so hard to watch what he does. I mean, so in any case, I don't know. I just think, everybody has their own sort of algorithms that are followed on social media, which is really how people are getting information. It's hard to break across those algorithms.
Kevin, do you want to ask your question?
Yes, thank you. Kevin Hardy, Penn Emergency Medicine. First of all, Dr. Offit, thank you for your tireless efforts in this regard, and greatly appreciated. And this goes to what has been just mentioned, and that is trying to convince the public at large. Often run into people who are on the fence, may have political leanings that lead them to support the current disaster in Washington, but in my opinion, but don't really have facts at hand. So with that in mind, this presentation, will this transcript be available? And is there a website or someplace that you would suggest that we can go to get, pick up these multiple studies that have been done and be able to show them to people, sort of on a one-to-one basis? And I'll take my answer offline.
Sure. So, yes, I mean, well, so I think there are many. I think our site, vaccine.chop.edu, has a wealth of information directed at physicians and others who have questions about vaccines. So all the questions, are kids getting too many vaccines too soon? Was thimerosal damaging? Why do we get a hepatitis B birth dose? We try and answer all those questions. And in addition, now that the ACIP is going to be meeting over the next 2 days, when they make recommendations, and I fear they're going to say that the birth dose is no longer recommended, and they don't want kids to be vaccinated against hepatitis B until age 4. That's the word on the street. That would be very damaging. I mean, if you get hepatitis B virus as an adult, you have a 5% chance of going on to develop liver cancer or cirrhosis. If you get it as a baby, as a child less than 12 months of age, you have a 90+% chance of going on to develop cirrhosis or liver cancer. And what we learned in the 80s when we first had a hepatitis B vaccine is that only half of the children less than 10 got hepatitis B from their mother, from passing through a birth canal from a mother that was infected. The other half got it from relatively casual contact from a virus that lives for at least 7 days on surfaces, even though it's a non-envelope virus. I'm sorry, that's an envelope virus. And that, that can be you have as much as 10 billion infectious particles per ml of blood in a hepatitis B infected person. There's 1.5 million people out there who are chronically infected with hepatitis B. There are tens of thousands of people who get hepatitis B every year. This is a virus which can be found in washcloths, towels, toothbrushes, nail clippers. I mean, that's how those less than 10-year-olds were getting it. Eliminate that as a birth dose, or at least as an infant dose, which is what every other country has. Then you're going to put those children at risk at a time when they're incredibly vulnerable. So we are going to constantly try, and every time those things come up, put that out there. And there are other groups do too. Things like science-based medicine. I think a great site is Unbiased Science by Jessica Steyer. She has a Substack that always immediately responds and gives great information. So there are good sources out there. I think we have to do everything we can to make sure people know about them.
Should we be concerned children may not be able to get COVID vaccines at all the following this week's ACIP meeting, or just that insurance may no longer cover them? I'm in New Jersey where the governor has said we don't need prescriptions, but I'm not sure if availability may change after ACIP this week.
What worries me the most here is that the Vaccine for Children's program. I mean, the Vaccine for Children's program covers maybe 55% of childhood vaccines. That's 35 million children, roughly. It only it only goes into effect if the ACIP votes for it, votes for, say, coverage for children. They still haven't done that yet. And if they don't do that, I worry that those children aren't going to be able to get vaccinated. I also worry because there's now going to be Marty McCarry has said he's going to show data on 25 children that died of COVID from the vaccine adverse events reporting system, which already is a contradiction in terms. You can't assign causality from the vaccine adverse events reporting system. The best thing you can say is it raised a hypothesis, and then you can test it in places like the Vaccine Safety Data Link, where you have a control group. I mean, you have to look at group of people who did or didn't get vaccinated to see whether there is an increased risk. Also, there was, thank goodness, there was a at least whistleblower at the FDA who, although he's remained anonymous, who said, we've looked at all those autopsies, these children did not die of COVID. But that's what he's going to say, because I think what you learn if you're going to be part of Robert F. Kennedy Jr.'s HHS is you have to bend a knee. And Susan Monterez learned that the hard way. That's why she's in front of the committee today. And Peter Marks learned it the hard way. Peter Marks was the head of CBER, right? Centers for Biologics Evaluation Research, which is the vaccines and biological part of the FDA. And when Kennedy Jr. became head of HHS, he visited Peter Marks and he said, I want you to show me the data where measles vaccine causes blindness and deafness. And Marks said, there are no such data. It doesn't exist. The vaccine doesn't do that. And he fired him. The point being, my way or the highway. And that's when RFK Jr. said Susan Monterez wasn't trustworthy. What he meant by that is she wasn't going to go along with everything he said. And so that's where we are.
Has Medicaid stopped paying for vaccines that are no longer recommended by the government? Is there a possibility that the government might forbid insurers paying for non-recommended vaccines?
I don't know. I'm probably not the person to answer that question. But it is a tumultuous time in terms of how it plays out in terms of insurance coverage and liability, especially for the,
Susan, why don't you go next? You're on mute. You're on mute.
Hi, Susan.
Oh, hi, Paul. Going back and forth between what was watching the hearing and now you. So you mentioned VAERS. And, my 12 years at the FDA, I spent a lot of time, with VAERS and talking to people and even testifying before Congress about some of the VAERS stuff. And the key is, it is so hard. It is so hard to explain to people why, if somebody has a bad event, dies within a day or two after a vaccination, that the vaccine didn't necessarily cause. And you can do the math and you can show, you can expect this many hundreds of people who are going to have something bad happen within a few days, given the number of those events that happen. I've done this for, I've done this for SIDS and I've done it for other things. You can expect this many. So if you find people that, that happened to, and you say, look, this is going to happen by chance, it doesn't click with people, especially for people for it's been their child that it happened to. I just don't know how we can explain VAERS to people so that it gets through.
No, I agree. First of all, I think it's misnamed. I think a casual observer will say, this is where vaccine adverse events are reported. I
Yeah.
wish it was called SPARES, suspected vaccine reporting system, because that would be more accurate. But you're right. I mean, we're always looking for causal associations. I remember my wife, who's in private practice pediatrics, came in on a weekend to help, was helping the nurse giving the vaccines at the time. And there was a 4-month-old sitting on her mother's lap. And while my wife was drawing up the vaccine into the syringe, the 4-month-old had a seizure, went on to have a permanent seizure disorder, epilepsy, and was dead at age 5 of a chronic neurological condition. If she had given that vaccine 5 minutes earlier, there are no amount of statistical data in the world that would have convinced her of anything other than the vaccine did it.
That's
And I
right.
think it's a powerful, we're always trying to argue what is a powerful emotional experience with statistics. And it's hard, but you're right. It's hard to get people to understand that vaccines are designed to prevent vaccine preventable diseases, not everything else that happens in life. So there's always going to be these temporal associations that aren't causal. And it's hard to convince people. I agree. I mean, my favorite is Jim Laidler. I don't know if you remember. He was I think an anesthesiologist from California, to show that there is no screening in VAERS. Everything gets reported to VAERS. It's a very noisy system. He said that after he got the flu vaccine, that he started to get bigger and greener, and he turned into the Incredible Hulk. So he wrote that up and reported it to VAERS. That report was in the system for years. I think it may have recently come out, but
There are 10, when I was there were 10 cases of reports to VAERS of HIV infection, AIDS, and the vaccine, suspected vaccine was some vaccine they had gotten as a child. I mean, you can pull out, all these ridiculous examples.
exactly.
You've touched on this, but how about giving visibility to families who face complications like SSPE, pertussis-related deaths, given the unfortunate distrust of science, which is another battle on its own?
So I'm not sure I understand the question exactly. So are you arguing for people who really are vaccine hurt by vaccines? Is that the question?
No, the question is like people, hi Paul. I've seen SSP here as the child neurologist, and I feel like people kind of don't believe us when I said, this is like a child that I saw who was a typically developing stray A student and in 3 months went to a persistent vegetative state, right? And it was horrible. And I'm just wondering, right, given that they don't trust us, like families, like first account witnesses of people like that, of the families have faced this horrible vaccine preventable complications as a way to, right, like mom to mom, get dad. They're only hearing from the people who are telling them my kid has autism because of vaccines or whatever. But how about hearing from the moms who were like, yes, I lost my child to SSP or to pertussis or to something like that?
No, I think you're right. There are groups like that. There's Families Fighting Flu, Meningitis Angels, National Meningitis Association. And those parents, God bless them, are their children suffered or invariably died from a vaccine preventable disease, and they didn't give that vaccine. And their way of processing that is to say, God put me on this earth for a reason. This is a terrible tragedy, the worst thing one can ever imagine. But I am going to now stand up and talk about the importance of this vaccine and how awful this disease was. And so they are advocates. I mean, people like Alyssa Kanowitz in the Philadelphia area, whose child died of flu, she's a compelling speaker. But you're right. I think, when I talk about that there's 5,000 measles cases or 270 flu deaths. I mean, it's 10 pertussis deaths. It doesn't resonate. It really, it's just another number. I think you need to make people feel what this is. And that's where the parents come in, really.
So, somebody asked, what is in it for RFK to dismantle the vaccine system? He's using autism as a boogeyman to justify his actions, but why? Is he a true believer or is he making money?
I think he's both. He's certainly making money. I mean, he was worked with the law firm of Wisner Baum. He would refer patients or plaintiffs to them. He made about $2.5 million over the last couple of years. And when Elizabeth Warren asked him at that second confirmation hearing, you can game the system. You can game the vaccine injury compensation program that financially benefits you and your personal injury lawyer friends. Tell me you're not going to do that. And he said, no, I'm not going to tell you I'm not going to sue pharmaceutical companies. So yes, he definitely makes money off of it. But I think more to the point, I think he believes it. I think he really does believe it. If you read his book, The Real Anthony Fauci, he's very consistent in this. He thinks no vaccine is of value. He thinks vaccines are not beneficial. When asked the question on a recent podcast, well, how about the polio vaccine? He said, nope, that vaccine killed many, 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 many more people, to quote him, than it ever saved. He's a believer, and he's unswayable. It doesn't matter what data you show him. I mean, there's 24 studies that show MMR vaccine doesn't cause autism. Doesn't matter. Still said it recently on Jesse Woodard's show. Maybe he's just paid to do it, and that's it. He's just yet another personal injury lawyer lining his pockets, like Aaron Siri, the guy who's his right-hand man, who was brought up today at today's hearing. I don't know if you remember that. So it's just Aaron Siri is a lawyer who works with him, who's just another low-life personal injury lawyer. But maybe that's it. Either way, he's certainly not backing off this position. I think he's a zealot.
So you all should look in the chat for some citations and an announcement about Peter Marks coming to speak. Are there any more questions for Paul?
Hi, Susan Coffin. Oh my God, I get to see. Hey, Susan. Oh, cool.
Wait, there's one word. Uh, Thank you for your advocacy. Yeah, that is the understatement of the world. The fact that you are upright and still letting people quote you and that you're coming to all of these things, you're invited. I feel like we're on a 3-year schedule, a 3-month schedule with you. It used to be once a year, then it's 6 months. I think we may be going to 3 months soon. But Paul, thank you for all you're doing and thank you for being so open about sharing with people.
My pleasure. Take care.
Take care.
Fight the good fight. All right. Bye bye.
Yeah.